The ICTA project is a 2-year project that is funded by the National Institute for Health Research, and it's a partnership between the Open University, Yorkshire MESMAC across York and Leeds, and the LGBT Foundation in Greater Manchester. We're also working with some of the gender identity services up and down the UK. So we're chiefly interested in understanding how integrated care happens for trans people. We're looking to see what's happening now, we're looking to see what could happen and how to improve it, and we're looking to join up what's happening so that people are able to make best use of innovations and to make arguments to understand what best practice looks like and how trans health can be improved to be equitable across the country and across the 4 nations as well, in order to see some of the problems that exist with accessing and experiencing trans healthcare be solved. So what we're aiming to change is the fact that trans people report a lot of problems with how they experience healthcare through NHS systems. A big part of that is enormous waiting times for access to gender specialist services, but also GPs and other doctors in specialist contexts have a lack of training and a lack of support around providing for trans patients, whether that's about how to talk about gender, how to sort of be respectful, or how to accommodate trans status into understanding or other healthcare issues, and whether that's relevant or whether it's not relevant. It's a difficult thing to do. Now, some people are already working hard on doing this, but there's a great inequity around where in the country you are and whether you happen to encounter a provider who has received training or is being proactive around these issues. So what we really want to do is identify good practices, help others to deploy them, but also to understand what makes good practice, create resources to help people execute new systems of integrating trans healthcare in order to reduce inequality across our healthcare service. Trans people should trust this research because we have a lot of trans, including non-binary people, working on this project, leading on this project. There's been real demonstrable commitment towards accountability to the communities. There's very much a sense that all of the team agree with the motto, "Nothing about us without us." We have a group comprised entirely of trans people to hold the project to account to trans, including non-binary communities, as well as having specifically recruited experts within academia and within healthcare practices to steer the project relative to what the funder requires of us. Across every level of decision making, we're committed to giving back to trans communities for their time and efforts, which involves even decision making around who designs material for us or who provides catering for us. So there is a constant level of engagement with making sure that the project is for people rather than just about people.